And now we come to urine therapy. This is a very difficult therapy for most people to get their heads around. It is a process of drinking one's own urine and also washing in it, as well as applying it in various other ways depending on the issue or ailment. Now, there are so many myths and taboos associated with this topic that people have a tendency to switch off at the mere mention of drinking one's own urine. So let's examine these myths. The first one is urine is a waste product. Well, no. Urine is actually the excess of the beneficial substances in the blood. The liver removes all toxins and pathogens from the blood. The kidneys receive the purified blood and regulates the amount of salts, vitamins, minerals, hormones, enzymes, amino acids and water in order to keep the blood in perfect balance, as having too much of something is just as bad as having not enough. And sometimes, while it is sitting in your bladder, your body might realize that it needs some of these life-giving substances and reabsorb it. Many have had the experience of wanting to go to the toilet and then getting distracted, and an hour or so later they realize they no longer need to go. That's because the body has reabsorbed enough of the urine and relieved the pressure on the bladder. Urine is a snapshot of everything the body needs in exactly the right proportions for you. It is also a holographic record of everything that's going on in the body right now. The medical term for urine is plasma ultrafiltrate, that is, ultra-filtered blood plasma. Your urine is literally your lifeblood. Amniotic fluid is also urine, firstly the mother's and then the baby's, and it's responsible for forming your lungs and your skin. It is most certainly not waste. Urine is dirty and smelly. Well, no again. Urine is one of the most sterile substances on earth. The pungent smell only occurs after it sits on an inorganic surface that's exposed to the air. Urine doesn't contain ammonia, but ammonia forms as a byproduct of its antibacterial properties. In fact, urine is actually a natural detergent, and it was what was used in Chinese laundries. The smell of urine is obviously affected by your diet, your current state of health, and even your emotional state, but it actually smells of you. It's usually dark and strong tasting in the beginning, particularly in the morning, but after a short period of detox, your urine becomes clear and sparkling, and after the body is completely detoxified, urine sometimes tastes of coconut water. If the body's getting rid of it, why put it back in? Well, as I explained earlier, it isn't getting rid of it because it's waste. It's dumping excess that it can't use at the moment. But the situation changes from moment to moment, and once urine is reabsorbed into the system, the body now doesn't have to expend lots of energy manufacturing any of these substances in the urine. So there is an almost immediate energy boost. Urine is antibiotic, analgesic, and an immune system booster. It contains growth hormones, minerals, vitamins, and endorphins which kill pain, lifts moods, and boosts energy. It is also packed with stem cells, which are prototype cells that can become anything: skin, bone, muscle, heart tissue, and literally they roam around looking for things to repair. Even the medical mafia and scientific priesthood are grudgingly accepting the power of stem cells, although they are nevertheless keen to hide where these stem cells come from and keep you dependent on their so-called expertise. Here, they acknowledge that these stem cells can regrow and repair organs, but imply that this process requires laboratory conditions and access to amniotic fluid, which, as I mentioned earlier, is urine. Don't be fooled. Your body has the inherent capability to repair itself and regrow damaged organs, and even limbs, without medical intervention, if you only allow it to do so. Why don't doctors prescribe it then? Well, because medicine is a racket. It's $1 trillion business, and if everybody knew how to heal themselves using urine therapy, then the medical profession and the pharmaceutical industry would disappear, because they would become irrelevant overnight, and their corporate masters would have to find some other way to quietly depopulate the West. Here is a quote from a Dr. Alan Greenberg. As a retired physician, I can honestly say that unless you are in a serious accident, your best chance of living to a ripe old age is to avoid doctors and hospitals, and learn about nutrition, herbal medicine, and other forms of natural medicine, unless you are fortunate enough to have a naturopathic physician available. Almost all drugs are toxic and are designed only to treat symptoms, and not to cure anyone. Vaccines are highly dangerous, have never been adequately studied or proven to be effective, and have a poor risk-reward ratio. Most surgery is unnecessary, and most textbooks of medicine are inaccurate and deceptive. Almost every disease is said to be idiopathic, without known cause, or genetic, although this is untrue. In short, our mainstream medical system is hopelessly inept and or corrupt. The treatment of cancer and degenerative diseases is a national scandal. The sooner you learn this, the better off you will be. In 1976, doctors went on strike in Los Angeles for 1 month, and the number of deaths fell by 18%. And during a similar doctors' strike in Israel in 1983, the mortality rate dropped by 50%. And you can bet, as soon as they went back to work, the death rate went straight back to normal. What does that tell you? Death by doctor is so common that the term iatrogenic death has been coined for it. And it is either the biggest killer or the second biggest killer in the developed world, depending on whose numbers you use. Doctors will not prescribe urine because it's not sanctioned by the medical associations. And it never will be sanctioned because it works. I couldn't possibly drink my own urine. It's all a matter of perspective. Many people who feel that they couldn't bring themselves to drink their own urine will not hesitate to eat a highly processed non-food that might be delicious, but it should be remembered that your stomach does not have taste buds, and while your mouth has been seduced with flavours designed to be addictive, your stomach has been poisoned with sometimes hundreds of chemical additives.